Welcome to the Medicare Savings Program, MSP training. During this training you will learn about the programs that are related to Medicare and how Medicaid fits in. This program is for financial assistance only and does not provide medical benefits. MSP falls under Health First Colorado Limited Benefits Program. Upon completion of this training you will be able to define what is a Medicare Savings Program from Health First Colorado. Identify the different parts of Medicare. List the programs and their benefits. Listen to member calls and identify where you would transfer the member. Let's begin with the different parts of Medicare.
Part A coverage helps pay for things like an inpatient hospital stay, skilled nursing facility care, home health care, and hospice care. With Medicare Part A, you can go to any hospital that accepts Medicare if you or your spouse paid into Social Security benefits through an employer for about 10 years. You will not have to pay a monthly premium for Part A. Most people fall into this category. If you or your spouse is a government employee or retiree who has not paid into Social Security but has paid Medicare payroll taxes while working, you are also eligible for premium-free Part A. But even though there's no monthly premium, you'll have to pay a deductible to receive hospital care, then a copay or coinsurance for the costs that are not covered. Medicare Part B is your outpatient coverage. This includes things like visits to your primary or specialty care doctors or outpatient hospital services. With Medicare Part B, you can go to any doctor who accepts Medicare. If you've already started receiving Social Security benefits, you will automatically be enrolled in Part B and you'll receive your red, white, and blue Medicare card about 3 months before your 65th birthday. You also may notice your Social Security check is a smaller amount than before. That's because your Medicare Part B monthly premium is automatically deducted from your monthly payment.
You may be eligible for a Medicare savings program and not even know it. These programs use Medicaid funds to help reduce out-of-pocket expenses, like premiums, deductibles, co-payments, and coinsurance. There are 4 types of Medicare savings programs. The Qualified Medicare Beneficiary Program pays for Part A and B premiums, deductibles, coinsurance, and copayments. The Specified Low-Income Medicare Beneficiary Program pays for Part B premiums. The Qualifying Individual Program pays for Part B premiums for Medicaid beneficiaries and is a first-come, first-served program. And the Qualified Disabled and Working Individuals Program helps pay Part A premiums for working disabled people under 65. Those who lost their $0 premium Part A plans after returning to work, those who do not receive state medical assistance, and those who do not meet the state-based income and resource limits. Medicare savings programs are funded by state Medicaid programs, and qualifications are based on income and resource level.
Let's review the information as it pertains to Health First Colorado. As stated, Part A covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. It is free for those that have paid Medicare taxes for at least 10 years. For those who may have a disability and did not pay Medicare taxes, can still receive Medicare Part A, however, they will have to pay a premium of up to $437 a month, and a deductible of $1,364 for each benefit period. The Medicaid program that helps pay Part A and B premiums is QDWI, and the program that pays premium, copays, coinsurance and deductible is QMB. Next we will review Part B. Part B covers certain doctors' services, outpatient care, medical supplies, and preventive services. The standard premium for Part B is $135.50, but can be higher for some. The deductible is $185 per year, and the coinsurance is 20% of the billed service. Medicaid's program, QMB, pays the premium, copays, coinsurance, and deductibles for Part B. SLMB and QI1 pays the Part B premium only. If the member has any full benefit program in addition to Medicare, with the exception of Magi Adult, BCCP, PE, then only the Part B premium is paid by Medicaid. Medicare Part C, also known as Medicare Advantage plans, is optional and it bundles Part A, B, and usually D, into one plan. It is managed by private insurance companies, and includes dental and vision. The cost depends on the plan. There is no Health First Colorado assistance associated with Part C. Medicare Part D is a prescription drug plan. The cost of this plan depends on the type of plan. The Social Security Administration has one assistance program, Low Income Subsidy, LIS, that helps pay premiums, co-insurance, and co-pays. If a member qualifies for any Medicaid program, they automatically qualify for LIS, and should contact the Social Security Administration. Low-income Medicare members that do not currently have a Part D plan can get temporary prescription drug coverage through LINet. If members on Medicare need a Part D plan for prescription coverage, refer members to SHIP. The 2 phone numbers you see on your screen are not in your speed dial within 59. If a member shows a status of pass in the CRM, but has no MedSpan, it is because they only qualify for LIS. Here are just a few things to remember. Medicare provides the coverage for medical benefits for those who qualify for an MSP. Health First Colorado, Medicaid, is financial assistance for Medicare premiums, deductibles, co-pays, or co-insurance. Medicare must pay the first 80% of a covered benefit, and then Health First Colorado will pay the remaining 20% for members who qualify for QMB. Health First Colorado is known as the payer of last resort. As a result, any eligible health care services that a member receives are paid for first by Medicare, and then by Health First Colorado. Nearly all Medicare recipients get Part A for free. If members do not get Part A for free, Health First Colorado will pay their Part A premiums for members who qualify for QMB or QDWI. If the member gets Part A free, and they refuse or terminate Part B, Health First Colorado will still pay the Part B premiums. QMB members receive a Health First Colorado member ID card and help with out-of-pocket costs. If the member has a full benefit or Benefit Plus program, Health First Colorado will pay the Part B premium. Can I, while on Medicare, get my prescriptions covered from Medicaid?
No, once you are eligible, you must obtain a Part D plan for prescriptions.
There are many reasons for transferring a member's with Medicare Savings Program benefit. Let's take a look at the 3 most common issues. The most common reason is when the member receives a bill from their provider, after Medicare pays the 80% portion of the bill. At this point, the agent, that does not have interchange access, should transfer the member to the main billing queue. Then there are members who are on Medicare, and are also on a program from Health First Colorado, that pays their Part A or B premiums, and the member states that those premiums are still being deducted from their Social Security check. It may take up to a month after the member qualifies for an MSP, for those premiums to be paid by the state. Any premiums deducted while the member was eligible for Medicaid to pay, will be refunded to the member by Medicare. If it has been more than a month since the member qualified for an MSP, and their premiums are still being deducted from their Social Security check, the member should be transferred to Sharon Braden. Last, there are members who will ask about what services Medicare pays for, or if they can get help with their prescription drugs. You will transfer these calls to Medicare for medical services, and to SHIP for prescription drug benefits. This call is about billing and the agent is new, and does not have access to interchange.
I'm calling because I received a bill from the doctor. I thought Health First Colorado was supposed to pay this.
Okay, can you tell me the date you went to the doctor?
I went October 5th.
Thank you. I'm going to transfer you to an agent that can help with billing.
Okay, thank you.
This call is about billing and the agent has access to interchange.
I'm calling because I received a bill from the doctor. I thought Health First Colorado was supposed to pay this.
Okay, can you tell me the date you went to the doctor?
I went May 5th.
Thank you. And can you tell me the amount of the bill?
$296.
I am sending you a provider notice letter that you need to give to the provider that is billing you. This letter explains that Medicaid will pay the deductible, coinsurance, and co-pays for your Medicare covered service. The letter also explains that under Colorado law, you are not financially responsible for the covered services. The letter will contain the necessary instructions for your provider to bill us correctly.
Okay, thank you.
This call is about a Medicare premium issue. It has been more than 30 days since member became active.
I'm calling because Medicare is still taking my premium from my Social Security check.
Okay, I see your benefit started on February 1st, and it is March 16th. Usually it only takes 30 days, so you will need to contact Sharon Bryden at 303-866-5402, so she can help you find out why your premium isn't getting paid. Would you like me to transfer you now?
No, that's okay, I will give her a call during my lunch hour. Thank you.
This is a call concerning benefits.
I'm calling because I went to the doctor, and I was told Health First Colorado won't pay for my procedure. I don't understand.
I see you have a Medicare savings program called QMB. This means that Medicare is your health insurance, and not Medicaid, so Medicare needs to approve your procedure. As long as the procedure is approved by Medicare, and they pay their 80%, Medicaid will then cover your 20% coinsurance, and any deductible you may have as a result. The only thing you will have to pay is the Medicaid copay amount.
So what should I do next?
Do you know if Medicare will cover your procedure?
So I should talk to Medicare and not Medicaid?
You are active for Health First Colorado QMB benefits, so I can transfer you to Medicare, or give you the number. You will need to talk with them, as they are the ones who need to approve the procedure.
Okay, could you just give me the number and I will give them a call?
Absolutely, it is 1-800-633-4227.
Congratulations! You have completed this training. Please review the summary objectives to ensure the training met those objectives. When you are finished, click Next. The department's definition of a person-centered approach is one that respects and values individual preferences, strengths, and contributions. The goal of the department's person and family-centered approach is to incorporate the value of person-centeredness into everything we do. This will ultimately improve the member experience by enabling all department employees to understand the perspectives and experiences of the people we serve. You have completed this training. Please click Exit to close the training or restart the course if you would like to view again.